Hello, and welcome to Set Science Lab, Mad Science Lab. Today we're going to be talking about shock, but not just any shock, burn shock.
Now I know what you're thinking, and it's, what's burn shock?
Burn shock is unique because it's a combination of distributive shock and capillary leakage and hypovolemic shock due to loss of fluids. This means fluid resuscitation on a massive scale is paramount to their survival. In fact, delays in resuscitation and insufficient resuscitation result in increased mortality. According to the American Burn Association, patients with severe burns should receive 2 to 4 mLs per kg per percent total body surface area burnt in the first 24 hours. Which, by my calculations, if you have a 100 kg patient, you're giving 8 liters in a 24-hour time period. The preferred fluid for fluid resuscitation in burn shock are crystalloids, most notably lactated ringers. However, only 25% stays within the plasma. The other 75% moves to the interstitial fluid, which puts patients that are receiving massive amounts of fluid resuscitation at risk for compartment syndrome. No bueno.
Now I know you're thinking, well, how do I even know if my fluid resuscitation is enough? Because you can give too little or also too much.
Yes.
Great question.
If you're thinking urine output, you're right. 0.5 ml per kg per hour is a good sign that your fluid resuscitation is working. Now I know you're thinking, how does this apply to me? Well, it's the summer. It's prime time where people like to light stuff on fire and blow stuff up. And you might find yourself in a situation where you have a patient with a pretty significant burn. And a significant burn is about 20% total body surface area. And those are the patients that absolutely require this extensive amount of fluid resuscitation due to burn shock. So quick recap. Burn shock is a combination of distributive and hypovolemic shock. It requires massive fluid resuscitation, 2 to 4 mLs per kg of percent total body surface area burnt, which starting at 20% is when you have a significant burn and should absolutely initiate this. However, you have to be mindful of fluid resuscitation and compartment syndrome because 75% of your crystalloid is going to the interstitial fluids, people. So, hope you learned something today, and cheers to doing good things for your patients. Learned something today? I did too, and I learned all from these amazing references.